Eastern Michigan athletics has affected my self-esteem positively. Being around athletes with similar body types and issues has made me feel as though I'm not alone.
Since being at Eastern, I feel more confident about myself and my body image.
Eastern Michigan Athletics does many positive things for student athletes, and the goal of the Whole Body Project is for all student athletes at Eastern Michigan to have a positive experience. However, there are some aspects of the sport environment that put athletes at greater risk for disordered eating and eating disorders.
Athletic competition can increase stress in athletes, and these effects are often intensified in individuals who already experience anxiety, depression, and perfectionism. When these stress effects are combined with the risk factors from the general population, the risk of disordered eating increases for athletes.
In fact, 46.3% of Eastern Michigan athletics surveyed said that they have experienced or know someone who has experienced disordered eating.
In a recent survey, EMU athletes shared some of the ways they had been affected by disordered eating or poor body image. Here are some of their responses.
I sometimes have a bad habit of obsessive calorie counting and freaking out if I eat anything unhealthy.
First, I struggle with body image because I would frequently be racing against girls much skinnier than me, and if I ever performed poorly, I would, and still sometimes do, blame it on my weight.
It is so easy to compare yourself to others around you at practice and just with the whole athletic community. It is hard to not get caught up in that certain desired body image and seek alternate means to get it.
So what's the difference between disordered eating and an eating disorder?
Eating disorders are medically diagnosable psychological disorders, of which the most common include anorexia nervosa, bulimia nervosa, and binge eating disorder. Disordered eating is a range of irregular eating patterns and behaviors that are typically less severe than those seen in an eating disorder. These behaviors may or may not develop into an eating disorder, but they do put an individual at higher risk.
Some disordered eating behaviors include purging after meals, skipping meals for fear of gaining weight, preoccupation with body shape, weight, or appearance, obsessive calorie counting, eating in secret, and avoidance of certain foods. So, although all eating disorders involve disordered eating, not all disordered eating meets the diagnostic criteria for an eating disorder.
However, disordered eating is still very serious. It can still affect your physical, mental, and social well-being and athletic performance.
Disordered eating and eating disorders can cause fatigue, muscle weakness, injury including stress fractures, increased anxiety and depression, and also affect major organs such as your heart, kidney, and brain.
Many athletes don't seek help because they don't think it's that serious. But disordered eating and eating disorders have serious health effects. So even though some disordered eating behaviors, such as dieting, weight loss, and excessive training, may be perceived as normal or even desirable, never be afraid to speak up or to seek help if you're concerned about your own or your teammates' well-being.
If you or someone you know needs help, please talk to your athletic trainer or contact Stephanie Rosales or myself, Allison Mankowski.